I'm happy to be here with Nurse Allie. I'm glad she stopped by Black Nurses Magazine and Beautiful Nurses Magazine. Um, Allie, my other COVID-19 nurse, we got tissues this time just in case. um, Tell me a little bit about yourself. Where you're from?
So I was actually born in New York City, and I moved down to Virginia. I lived in California for probably the last 15 years, and I've been traveling for the last 3 years. So I have a lot of places to call home. And I was called upon this journey to come and join the COVID-19 war, actually by a few friends that messaged me and said, "Hey, you have to go. This seems like a perfect opportunity for you." And it's in your city, you know. And I said, "Okay, well, let me call them." And they said, "Well, can you get on the plane tomorrow?" I said, "Well, wow, I don't really know about tomorrow." And they said, "Well, I think you could do it. Maybe we can get you on the plane for Friday." And then I came out here to help all the nurses out here. And we've been in this together ever since.
Yes, we have. We have. And what has your experience been like as a COVID-19 nurse?
Whew, child. We didn't really know what we were walking into.
That's true.
We kind of, initially we sat around waiting for our assignments, and we were excited to be here, but at the same time we were anxious and nervous and scared, and we had all these anxieties. And then when you walked into the hospital, you had to hit the floor running.
Right.
Ground zero is the only way that I can call it.
It really was a war zone.
It really was, and you saw patients lined up, stacked up in rooms, patients on stretchers, not even having beds, not having the proper equipment. A lot of them were very severe, very critical. But you just do the best that you can. That's what everyone was just saying. Do the best that you can. I think I tried that a couple times in the computer too.
Did you?
Why are you late on your medications? Doing the best that I can. But I do remember one instance where, a usual assignment, you have about 5 to 6 patients if you're on a medical floor. And this particular day, I started off with 10. And one of them was on a ventilator. And I've had a little experience with ventilators, but not to the point where I can manage the ventilator by myself. Usually there's a respiratory therapist that does that for you, but respiratory therapists are so limited that you got to figure it out real quick. So this day was rough, and I didn't think it could get any tougher until they rolled up yet another patient, and then yet another. So 12 patients, and my last patient was status post a cesarean section 8 hours ago. She was tested for COVID and was positive. So she was separated from her baby, and I don't know how to deal with the mom. I've never dealt with a new mom, and I felt bad for her because I didn't feel like I was enough, and it's really hard when you want to be the best nurse possible, but you have no time to say, "Mama, it's okay. I know you're away from your baby, and I know you're in this dark room, but you're not alone." And I can't say you're not alone because you are. But I did the best that I could, and then they roll up a breast pump. I don't know anything about a breast pump, but I said, "Mama, we gotta learn. We gotta figure this together." But I remember leaving that day and saying, "I don't know if I feel like a hero today. I don't know if I feel like I'm enough." Not necessarily because I'm not a great nurse, but there's so much you could do.
Yeah.
And I think the next day I went, and there was another floor, and everyone had called out on that floor because staff is scared, and they're sick, and they're tired, and they're worn down, which I do understand. But I was at the hospital for maybe 2 weeks, and I was the charge nurse. And we had a patient who was desaturating, meaning he was hypoxic and needed oxygen and needed help quick. And in the midst of me trying to figure out how to make an assignment, I have to take care of this critical care patient and also deal with 2 baby nurses. Like, they gave me 2 new grads. One was fresh out of school. Another was 4 months in and had only worked at a skilled nursing facility before they came to the hospital. They don't know anything, and I can't be mad at them. I just have to try to help them as well.
Exactly.
But again, you do what you can, and
because it was like it reminds you of a war zone.
It does. Like an episode of MASH.
Exactly.
Yeah.
It's just like all hands on deck.
It is.
And let's get it done.
Mhm.
It's just like the mom. And by the way, you were a hero that day. Just being there, being able to touch her, to touch the patients. You were a hero. You are a hero.
Yeah.
And I'm thankful for you for being there and doing that. It was different, and I don't think anybody was prepared for that. But I just find it so remarkable that nurses from all over the country, would you say hundreds? I would say we even had close to 1,000.
Close to 1,000, yeah.
Yeah, that came here not knowing what they were going into. They were going into war, and they did it. You know, so that makes me happy to know that we supported them, and at the same time, it gives me relief that we had some beautiful nurses here doing the best that they could, like yourself. You know, like you said, 2 weeks here and you're charge nurse. But I believe that God restores, and He is already starting to restore. And so you said you went down. Tell us about your ED experience and what that was like.
So
ED stands for emergency department.
Yeah. So they sent me down to the emergency department, and I have a little bit of experience, but usually when you are taken on an assignment, they want you to have at least a year experience before they put you into a new specialty. But at this point, again, all hands on deck. So I went down there, and there was about this much emergency room and this much ICU patients, everyone. I've never seen 23, 25 patients on a ventilator in an emergency room. That means if they're sitting down in the ED, there's no room in the rest of the hospital, because we had 99 ventilators. All the ICU floors and the makeshift ICU floors, all full. So they're sitting down in the emergency room, which means emergency room nurses are taking care of ICU patients. And the mentality difference between an emergency room nurse is let's get them done and let's ship them out. Whereas ICU nurses is like very meticulous. You have to pay attention to the little details. Two completely different personalities. But I really feel like God pushed me there, because I was on the medical floors and I was praying. I said, I don't know if I can do this. And He presented this opportunity for me to go down there and show these emergency room nurses how to be ICU nurses. Pay attention to turning your patients, to doing eyes and nose, how to properly titrate your drips, and so on and so forth. And
not to cut you off, just doing drips alone. That's
doing drips alone is oh my gosh,
yes, it's a totally
it's a
different
learning
skill.
curve. Yeah, it's really tough, especially when you have 6 of them.
Yes.
And one wrong number, you could kill someone. So you really have to pay attention to what you're doing. And I remember the charge nurse of the emergency room grabbing me, and she said, wow, you are incredible. I really feel like God brought you here. And I just cried. I just cried because I said, you know, I've been looking for my purpose ever since I've been here. I've been looking for, God, why would you put me through all this pain, through this blood, through this tears, everything, that all of this? What am I supposed to learn? I know I'm supposed to help, but when everyone is dying around me, and when she said that to me that day, it awakened the light in me. And I said, you know what? I can't forget. I got to keep my eye on the prize. I have to keep my eye on my purpose, that I am here to do no harm and to help every single person that I touch. And if I save one person, or help one person smile, whether it's a nurse or a coworker or the housekeeper or whatever, if I can save one person that day, I've done something right.
You've done beautiful.
Yeah.
And you are beautiful.
Thank you.
Thank you for stopping by. I know, to see what has happened through this whole pandemic and COVID-19. Because as a nurse leader, manager, just, you know, an array of experience in nursing, I think what pulled my heartstrings was just how many nurses were here to help. And they didn't know what they were walking into. And I said, who is capturing this? And then, who is capturing Black nurses?
Because that's the
so
majority that's here.
That's the majority that's here. And some to help. And sometimes I found in